nearly 600 Utahns have died from COVID since the beginning, just 20 in the last 2 days. But talking with the experts and looking at the numbers, Utah's death rate is much lower than other parts of the country.
He's the one that basically raised me, taught me everything.
Julio Hernandez's name is on the growing list of COVID-19 victims in Utah.
Just seeing him wheel him into the ambulance, I started crying.
Julio spent several days in the hospital. In early July, his lungs lost nearly all of their function. He was just 56.
My heart literally shattered to pieces. I couldn't cry. I wanted to cry. I felt like I had lost everything.
Since then, the number of people dying has only climbed higher. Nearly a quarter of all COVID-19 deaths happened in October. The CDC predicts deaths will climb 13% by Thanksgiving.
We really need to break the cycle of transmission of this virus right now.
Utah's death rate remains small compared to other states, with the CDC reporting the 7-day average at 0.1%.
We have a very low death rate, and that's wonderful, but that doesn't paint any of the picture of the stress on the public health system.
The state reports record high hospitalizations have overwhelmed 2 major hospitals, with staff struggling to provide services, a scenario Caesar hates to see.
It could happen to anybody, a young person to an older person. I mean, it's a lot of deaths.
Now, Dr. Vento says the positive test rate is also important, and today that hit another new high, over 18%, and that means the virus is spreading in the community and more people are getting it and they aren't getting tested. Reporting live in Salt Lake City tonight, Haley Higgins, Fox 13 News, Utah.